Xofluza is a medication used to treat the flu, influenza, if your symptoms started less than 48 hours ago. It helps make the symptoms, such as stuffy nose, cough, sore throat, fever/chills, aches, and tiredness, less severe and may shorten the recovery time by 1 to 2 days. Xofluza works by stopping the flu virus from growing. It will not treat other kinds of infection besides the flu virus. Xofluza may also be used to prevent the flu if you have been exposed to someone who already has the flu, such as a sick household member, or if there is a flu outbreak in the community. It's important to talk to your doctor for more details. This medication should not be used in children younger than 5 since it may not be effective. It's also important to note that Xofluza is not a substitute for the flu vaccine. Before taking Xofluza, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. Xofluza is taken by mouth, with or without food, as prescribed by your doctor. Usually, it is a single dose based on your weight. To get the best results, take Xofluza at least 4 hours before or 2 hours after consuming any products that contain aluminum, iron, zinc, selenium, calcium, or magnesium. These can interfere with the effectiveness of the medication, such as antacids, vitamins/minerals, dairy products, and calcium-enriched juice. It's important to note that other infections may have similar symptoms to the flu or may occur alongside the flu. In these cases, different treatments may be necessary. If you experience new symptoms during or after treatment, or if your condition does not improve or worsens, be sure to inform your doctor. Xofluza typically has very few side effects. If you experience any unusual effects, be sure to inform your doctor or pharmacist right away. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction can occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects. If you notice any other effects not listed, be sure to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before taking Xofluza, make sure to inform your doctor if you have any allergies or if you are allergic to any of its ingredients. Also, let your doctor know about your medical history and all the medications you are currently using, including non-prescription drugs and herbal products. If you are pregnant, only use Xofluza if it is absolutely necessary and discuss the risks and benefits with your doctor. It is not known if Xofluza passes into breast milk, so consult your doctor before breastfeeding. Remember to always follow your doctor's instructions and recommendations when taking Xofluza. When taking Xofluza, it's important to be aware of any potential drug interactions. These interactions can affect how your medications work and increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. If you have received a flu vaccine in the nose within 2 weeks before treatment with Xofluza, be sure to inform your doctor. This medication may lower your protection from the flu vaccine given in the nose. After treatment with Xofluza, it's important to consult with your doctor or pharmacist before receiving a flu vaccine. If someone has taken too much Xofluza and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. It's important not to share Xofluza with others. This medication should not be used as a replacement for the flu vaccine. It's best to talk to your doctor about the risks and benefits of getting a yearly flu shot to help reduce your risk of getting the flu. In this video, we're talking about Xofluza, a prescription medication used to treat the flu. Xofluza is used in people 12 years of age and older who have had flu symptoms for no more than 48 hours. It comes in a tablet form and is taken as a single dose. It's important to take Xofluza as soon as possible after flu symptoms appear, and it can be taken with or without food. Remember to follow your doctor's instructions and the information on the prescription label. If you have any questions about Xofluza, talk to your doctor or pharmacist. When you have Xofluza at home, it's important to store it at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When you no longer need the medication or it's expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.